The following portion of Studio 512 was sponsored by Bone Doctors Orthopedic Care. Just in time for spring sports season, if you're looking for orthopedic urgent care and help for sports medicine injuries, Bone Doctors Orthopedic Care wants to help. Dr. Christopher Jimenez and Dr. James Michael Bennett are here to tell us more. The very first thing I want to do is kind of point out why you guys are so special. So Dr. Bennett, if you would, talk to me about a surgeon with fellowship training versus someone who maybe has just gone through surgeon training and has gone out into the world.
That's a great question. I think if you break it down in regards to the amount of training that doctors do, it's extensive. After college, we go to medical school. After medical school, you can set up to a residency, and the residency usually is about 5 years for orthopedic surgery. And for the most part, you learn the basics and the principles of orthopedic surgery. And then after that, you can go into subspecialty training, which is an extra year of fellowship. And there are multiple disciplines that a doctor can choose for specialty training, including hand and upper extremity, total joint arthroplasty, spine, sports medicine. And
I want to check in with you, Dr. Jimenez, as well, because you actually have a different specialty.
Yeah, that's correct. So I primarily do joint replacement surgeries, specializing in anterior approach hip replacements and knee replacements, and then revision or redo joint replacements. As I founded the clinic back in 2020, I envisioned a model where I recruited nothing but orthopedic subspecialists to the practice that each have their own specialty. In our clinics, we have nothing but subspecialists ranging from upper extremity with hand and shoulder, as well as sports medicine, and myself as a joint replacement surgeon.
Dr. B, talk to us about your sports injury clinics. This kind of falls right into your wheelhouse.
Exactly. I think the biggest issue when it comes to sports injuries is accessibility to doctors quickly and efficiently. And
Sure.
I think that what we have established now, we have a number of healthcare professionals and providers that are actually specially trained in orthopedics, and so they can evaluate the patient appropriately, give them a diagnosis and a management, or at least a plan of management.
What would you say to someone who hasn't been to Bone Doctors but might find themselves in need of your skills?
As I mentioned before, I think accessibility is everything. I mean, our objective is to get patients in as soon as possible. As I mentioned before, getting a diagnosis and a management plan, and also educating them on their injuries. But phone call, get you in, get an x-ray, get an evaluation, get a plan. That's all in the big plans. That's what we're going to plan to do with our urgent cares.
Absolutely, and get on the road to recovery. Okay, doctors, thank you so much for your time. We appreciate it.
Thank you.
Thank you.
Bone Doctors have 3 locations: San Marcos, Austin, and Bastrop. Find the one nearest you and learn more about getting started today at bonedoctors.com. The preceding portion of Studio 512 was sponsored by Bone Doctors Orthopedic Care.